Thanks, everybody. Good morning, and thanks to Equally Well for having me. So as suggested, my name is Law Edwards. My pronouns are they, them, and I'm an exercise physiologist working in the Justice Health and Forensic Mental Health Network in the Forensic Hospital. I want to acknowledge the traditional owners on the land on which I'm presenting today, the Gadigal people of the Eora Nation, and pay my respects to elders past and present. I also want to acknowledge our lived and living experienced individuals and the carers that work alongside them, and recognise the strength, resilience and capacity of these communities, and welcome anybody here with us in the room today. Finally, I'd like to recognise and express my appreciation for the patient voice that contributed to the story that I'm going to share with you today, and also to my colleague Elise, the dietitian, who is actually over in Europe these days, but was crucial in setting up these services initially. So the presentation will outline the steps taken to produce an implementation plan for the integration of physical activity and nutrition services inside a high secure forensic mental health setting. The focus is on understanding the importance of integrated physical health care and the role of mental health services in that, illustrating the value of the consumer voice in shaping physical health services. I'm going to explore the complexity of integrating these kinds of services in the really unique boundaries of a high secure setting and provide practical ways to embed new services in any mental health settings. So let me start by sharing with you some feedback from one of the patients that were involved in the project that I think really highlights the impact it can have to include their voice when shaping any service in a mental health setting. I appreciate that we were asked for our opinion, especially in here where everything is usually dictated and controlled. So to be asked in the first place is a privilege, and then for it to be taken and actioned is another level of respect, which you crave in here. I think that's really powerful. Considering the symposium we are attending, and it's day 3, I do not need to remind you of any of the inexcusable statistics around physical health and mental health. But I will tell you that on a local level, the statistics are consistent inside the inpatient setting that I work in, and that what is arguably the most crucial point and in the case for change is that the patients themselves are requesting the services and support for their physical health in these environments. When patients were asked what the Forensic Hospital could do to improve the journey for patients, a key response was a focus on and access to physical health services. They said it's an important part of the mental health journey to be in touch with these services like a physio, dietitian, etc. And they described wanting to be able to access the right supports within a reasonable amount of time. And that's obviously consistent with the state and national guidelines and policies for people living with mental health issues. So let me set the scene. The Forensic Hospital is a 135-bed facility for individuals experiencing mental illness who have been in contact with the criminal justice system. So that's individuals who have committed a crime and the state deems them as having committed that crime but not guilty due to their mental illness or cognitive impairment. The Forensic Hospital provides care to adults, men, women and adolescents. The dietitian and exercise physiologist were employed permanently in the Forensic Hospital in just 2020. Prior to our employment, any interventions targeting nutrition or physical activity were provided by non-specialist staff, nursing, medical, other members of the allied health team. So the interventions have not routinely involved or targeted consumers' preferences or requirements or involved consumers in their design or delivery or evaluation. But dietitians and exercise physiologists are really best placed to champion the cause of chronic disease and both in prevention and treatment and management through evidence-based patient-centered care. We have an understanding of the symptoms of mental illness, evidence-based strategies to overcome the really unique barriers that this population group faces and unique especially in this environment, and a focus on sustainable behaviour change. And it's not asking more of those who are already overworked and under-resourced to then also provide this service that they don't necessarily feel comfortable providing. In the general population, there are barriers to implementing and engaging in healthy lifestyle interventions such as confidence and knowledge and time constraints for everybody. In the mental health population, there are significantly greater barriers. to engaging in the healthy behaviours such as the side effects of medications, staff attitudes, negative symptoms, social support, stigma, cognitive impairment, therapeutic nihilism. Not an exhaustive list. But in a secure setting, there are really additional and very unique barriers, including restricted access to outdoor space, highly controlled environment, a lack of appropriate clinical supports. And these barriers exist at the patient, staff, and organisational level to implementing the recommended physical activity guidelines in a high secure setting. As clinicians, we arrived on the scene, we're taking all this background information into account, we have our own clinical knowledge, and we're forming ideas about how we can address these gaps. But prior to jumping in and running our services based solely on our knowledge alone, we wanted to then consider and understand what the physical health services mean to the patients themselves and how they want to be receiving them. Our QI set out to engage patients as a significantly actively involved in the development and deliberation and how we deliver and evaluate and improve our services. We acknowledge that this is not co-design. The power imbalance in this environment is high. And so we aren't suggesting that that's what we did, but we certainly tried to engage consumers and patients in the journey and in the process as much as we could. We started out by benchmarking against other mental health services, looking both just generic inpatient settings as well as other forensic settings. We did an analysis of current processes, developed a driver diagram, looking at the problems to be solved and considering some change ideas. So those change ideas were focused around running patient focus groups. So taking an hour to sit down with patients and on each ward unit and hold open discussions, asking questions and prompting creative thinking, so that we could spend time trying to increase our understanding of their past and current offerings, and what's worked well and what hasn't worked so well for patients to date, as well as individual patient consultation. So we conducted a survey in one-on-one settings as well to ensure that we had it was the exact same format as the group forums, but one-on-one so that individuals who didn't want to engage in a group setting could also participate and provide feedback. We also conducted consultations with frontline staff. We did interviews with senior health professionals and managers, and we utilised staff in services to gain insights from those working on the ground, nursing team members and medical, to get a better perspective of what it's like from their perspective. At the time of our project, there were 128 patients residing in the forensic hospital, and we were able to engage 69% of those patients in either a focus group or a survey, providing really valuable input on their experiences to date and preferences for how they want to receive nutrition and physical activity services. Just to note, of our population group, 15% identifies Aboriginal or Torres Strait Islander. In comparison, as we know that is consistent with the rest of the incarcerated population, where the numbers are much higher for those groups in comparison to the general population, 3 or 4%. The surveys and forums asked patients what physical activity and nutrition programs they currently participate in, as well as how satisfied they are with these programs. So this list here is describing what they have done to date prior to our services being implemented. And it's really useful and important information. We want to build on top of what works, of what they like, and take what they value and go from there. And I think what's so interesting about this is that it really identifies the enablers to engaging in physical activity in the form of good resources. At the Forensic Hospital, we have a small pool, a basketball court, a small gym, a field, a range of things. It's not, the equipment is specially designed, those kinds of things. But we have really good resources as an EP, some of the best that I've been lucky enough to work in, which makes sense because individuals are there for a significant period of time and they have no access to anything else. So it makes sense that those resources are there, but what it doesn't provide is an opportunity to use them if you don't know how. And we know this because our patient population is the exact same as in general in mental health, and our numbers and our statistics are the same in terms of their disease risk, despite having access to such wonderful resources at their doorstep. So next, patients were asked to comment on what physical activity and nutrition programs they would like available to them in the future. And we did this both in an open forum discussion, as well as providing options that they could select and say how interested are they in these services. So of note, walking group is the highest. That's actually because at the time when we were running these surveys, there were extra restrictions in place because of COVID, and so they had restricted access to their ability to just walk the grounds and be there, and so that really prompted us to get out there and advocate for that to be returned to them as immediately as possible. But I think that the real priority areas that you can see here is individualised exercise programs, clinician-led groups, and cooking programs where the focus is on nutrition advice. Right now, there is cooking programs available. They are not often, but they're present. But they're run by the OTs, which are excellent, but focus on functional capacity and don't necessarily have a focus on nutrition at this time. So that was the kind of choose your path. And then in the open discussions, what we found was real patient preferences for individual advice and support, variety, qualified and trusted professionals. You can see here that they're saying it matters to know and trust the facilitator. I want the facilitator to be experienced. I want more time with them, once a week, not once a month. And it should meet the needs of everybody who's attending. So to my point from before, and even from Simon's yesterday actually, that just having the resources in the facility isn't enough. You put a gym in a residential building and it doesn't mean that there's engagement from people who don't know how to use a gym. It only provides engagement to those who are already comfortable in that space. And the same is true here, and they're identifying that for themselves. They want specialised support to engage in the resources in a meaningful way, and that's how we can achieve meaningful outcomes. From the staff consultations, we spoke to peer workforce, primary care, allied health, psychiatry, Aboriginal workforce and nursing. And there was generally an appreciation of the EP and dietitian role, wonderful that they exist, but not necessarily an understanding of how to refer or when to refer to those areas. They acknowledged really good work done prior in terms of our metabolic screening process, being up and running, really consistent in core business, but no clear direction on what to do or how to intervene once they've completed that screening. There was a generalised assumption that because there's only the two of us in the service, that probably you'll just do broad sweeping, generalised support, big sports groups, big group-based activities, and that there isn't room for individualised programs or targeted interventions. And that staff in general felt as poorly as the patients did about the food service that they are provided. That in general, better technology and equipment could be useful in improving the patient engagement. So we grouped these into the 4 key themes you see there. And this is how we developed our implementation plan. So once all the staff and patient feedback had been collated, analysed, it was used to develop what you see here, and it was really focused on providing realistic timeframes. So we set goals based on, as you can see, initially quick wins, things focused on the consumer feedback, the phase 2 evidence-based programs, thinking about how we're going to make sure these things are actually going to provide meaningful outcomes, and phase 3 core business. What we want is for it to be consistent always. I'm going to go into more detail about what that looks like, but just as part of that was also developing a program logic so that we could consider detailed outcomes and how we were going to evaluate effectively what we'd put in place. So that implementation plan looks like this. So phase 1 was really the quick wins. So we've made updates to the record timetable to adjust patient access and increase the number of opportunities for clinician-led sessions, running broad spectrum health promotion sessions, updating some of the equipment that we have available, and initiating forensic hospital events. So last year we ran a triathlon over 3 days. It was amazing to witness. And this year we're working on an athletics carnival. And these events, these hospital-wide events, are organised with the patients. So the patients attend a event planning meetings, and we all contribute together to figure out what those events are going to look like and how they're going to run. In terms of phase 2, we're thinking about evidence-based programs. There's 2 of us, there's 135 patients. And so how are we going to engage people effectively and with up-to-date research? And so utilising students and having them assist us in developing and formulating planning group activities, and certainly finding that they have found that to be a really invaluable experience and opportunity to learn in such a unique environment. And then phase 3, which is, I think, a really important part of it, and something we're really into at the moment, is looking at the core business. How can we focus on creating sustainable services that did not just rely on a good clinician, but are actually sound, consistent, they're a part of policy and procedure, they're embedded, and they can't be erased, which I think is really important. So we have a bigger team now. We have a really small selection of speech pathology, physio, and a few other services. We have a new menu project working on updating that for our patient population group for every single meal. We're developing models of care and adding to policy and procedure. I'll just finish on a story, if that's okay. So this is to highlight what this has meant to our patients. I wanted to share this story. So the patient said, "I like the forums. Being asked gives a sense of ownership over what happens in here, and you feel heard. Physical activity aspects feel more implemented than the nutrition ones, and it feels difficult to get change to nutrition things in here. Something I personally asked for was individual programs, and I've seen such an improvement. Personally, I've never exercised before I came in here. To have someone come alongside me, provide that support, and make the program suit has made all the difference, and to watch myself improve has been really motivating. It's helped my mental and physical well-being. Being in a forensic hospital or mental health facility, my perceptions wouldn't be that there would be a fitness journey. It really helps the overall experience in here to be able to access these services, especially when I'm feeling like things are hard or low. It's something that I'll take into my life outside of here, and if it was all I took away, that'd be great." I'll finish there, because I know we are short on time. Thank you so much.